Hi DS, today we discuss about stroke. A stroke is a serious life-threatening medical condition that happens when the blood supply to the part of the brain cut off. Next is types of stroke: ischemic stroke, hemorrhagic stroke, transient ischemic attack, brainstem stroke, and a cryptogenic stroke. Ischemic stroke is a blood supply to the brain stops due to a blood clot. Hemorrhagic stroke. A weakened blood vessel rupture and prevent blood flow to the brain. It may also lead to subarachnoid and intracerebral hemorrhage. Transient ischemic attack or TIA. Blood supply to the brain is temporarily interrupted due to temporary clot. Brainstem stroke happen when the blood supply to the base of the brain is stopped. Cryptogenic stroke if the cause of stroke cannot be determined. Risk factors are hypertension, high cholesterol, atrial fibrillation, diabetes, smoking, alcoholism, and a sedentary lifestyle. Locked in state is a condition in which patient unable to speak and can't move except for vertical eye movements. Communication established through eye movements. They are conscious and they can think and hear. Diagnosis by CT brain, MRI brain, blood tests like CBC and coagulation profile, carotid ultrascan, echocardiography, and cerebral angiogram. For the ischemic stroke management, thrombolytic drugs we are using. Tissue plasminogen activator to be administered within 3 to 4.5 hours of onset of symptoms. Mechanical thrombectomy within 24 hours of onset of symptom. Surgery to remove plaque from the artery. Medications such as aspirin, clopidogrel, atorvastatin, and blood thinners we are using to prevent further clot. How to administer Acteplase? The recommended dose is 0.9 mg per kg. The total dose should not exceed 19 mg. 10% of the total dose to be administered as an IV bolus over 1 minute and the remaining as an IV infusion over 16 minutes. Treatment of hemorrhagic stroke. Medication to reduce blood pressure, prevent seizure and prevent blood vessel constriction. Surgery to repair the brain aneurysm by coiling or clipping. Stent to support weakened artery wall. Craniotomy to relieve pressure on the brain. Stroke rehabilitation in that speech therapy, physiotherapy, occupational therapy, and cognitive therapy. The 8 Ds of stroke care: detection, dispatch, delivery, door, data, decision, drugs, disposition. Critical time periods or barriers at the hospital which should be minimized from the ED arrival. Immediate general assessment within 10 minutes. Immediate neurological assessment within 25 minutes. Acquisition of CT of head within 25 minutes. Interpretation of CT scan within 45 minutes. Administration of fibrinolytic therapy timed from ER arrival 60 minutes. Administration of fibrinolytic therapy timed from onset of symptoms 3 to 4 hours in selected patient. Administration of endovascular therapy timed from onset of symptoms 6 hours in selected patient. Admission within 3 hours. This all about CVA. Thank you, dears.